She's going to talk to us about a new scalp cooling device that seems to prevent hair loss in women with chemotherapy.
Thank you. It is my privilege to present to you the results of the scalp to my institution by the sponsor. Listed are the other authors' disclosures. The main objective of the study is to demonstrate that the Orbit Attachment Hair Loss Prevention System is safe and effective in reducing chemotherapy-induced alopecia in women with breast cancer. This clinical trial is the first randomized trial in the world to evaluate modern scalp cooling. The trial accrued participants from December 2013 to September 2016. It was open at 7 sites across the United States. Key inclusion criteria were stage 1 and 2 breast cancer and plan to have either neoadjuvant or adjuvant chemotherapy. Key exclusion criteria were migraines, hypothyroidism, and other controlled medical conditions. After enrollment, eligible participants were randomized in a 2-to-1 ratio to scalp cooling or no scalp cooling. Randomization was stratified by site and type of chemo. The device was worn for 30 minutes prior to chemo, during chemo, and for 90 minutes after chemo. Alopecia assessments were made at baseline and 2 to 4 weeks after each chemo by a blinded healthcare provider, the clinician, and the participant. The participants were also asked if they needed to use a wig. Here are examples of alopecia assessments. Alopecia was assessed using the common terminology criteria for adverse events version 4. Grade 0 is no hair loss. Grade 1 is up to 50% hair loss not requiring use of a wig, and grade 3 is 50% hair loss requiring the use of a wig. Success was a grade 0 or 1. For those wearing the device, a comfort scale was administered with each used to rate device comfort. There were 3 quality of life questionnaires which were administered at baseline, after 4 cycles of chemo, and at completion of chemo if more than 4 cycles. Scalp planned to enroll 235 participants with an 85% power to detect a 20% absolute difference in hair preservation. One interim analysis was planned to allow the study to stop early for efficacy after 142 participants were evaluable for the primary endpoint. On September 26, 2016, the Data and Safety Monitoring Board agreed to stop accrual to the study due to superiority of hair retention in the participants who received scalp cooling. The results of the interim analysis are being presented today. There were 229 participants that signed consent, of which 182 met eligibility criteria and were randomized to the scalp cooling device versus control. The modified intent to treat population is those in the interim analysis that were randomized and completed at least 1 cycle of chemotherapy. The most common reasons for ineligibility were anemia, migraines, hypothyroidism, and stage 3 breast cancer. The most common reasons for randomized participants not completing at least 1 cycle of chemo were that the participants changed their mind or that they were randomized to control and wanted access to the cold caps. Of note, 6 participants withdrew during the pre-cooling phase, 4 of these because the device was too cold or uncomfortable, 1 due to anxiety, and 1 due to claustrophobia from the cap. There was 1 additional participant that withdrew during chemo because the device was too cold. There are an additional 60 participants that are not part of this analysis today. The results of the interim analysis showed that in the scalp cooling group, 50% of participants retained their hair, and in the control group, 0% of participants retained their hair, with a p-value of 0.0001%. There were a total of 54 adverse events, all grade 1 or 2. The most common were headache, nausea, and dizziness. There were 8 unanticipated adverse events, which included dry skin and scalp pain. Here is the patient-reported comfort scale. Most participants rated the device as reasonably comfortable, and very few found the scalp cooling device to be uncomfortable. The quality of life assessment showed no significant difference between the scalp cooling group versus control, or in the successful hair retention group versus alopecia group. It is known that scalp cooling devices are more effective in preventing hair loss for certain types of chemo, such as taxanes. In scalp, the hair retention rate with taxanes was 65%, and with anthracyclines was 22%. The other U.S. trial with scalp cooling devices was prospective, but not randomized, and only included taxane-based chemotherapy with a similar hair retention rate of 66% using a slightly different alopecia grading scale. In conclusion, scalp cooling devices are highly effective and should become available to women with breast cancer receiving chemotherapy. Based on the results of the study, CTCAE will file for FDA clearance of this device. Further studies should be done exploring this technology for other types of tumors and with other chemotherapy regimens, and more studies looking at the impact of chemotherapy exposure and the cycle of regimen should be performed. Thank you.
That's the first question. This study to begin with the easy thing to get approval. Tell us what we do.
So what we do is that scalp metastasis. So the way scalp metastasis work is that constructive retina, and there's something that
what you'll see if this goes on, but it's not to the head, if it's not applied
Correct.
properly, there may be patches or areas, particularly at the top of the head, where you will have hair loss. So I'm thinking you can further improve upon this
I
if there is a
agree.
proper seal.
There's a learning curve for sure, and you
Yeah.
might want to mention that.
Yeah, so I was going to go through this more during the actual presentation later, but the fit of the cap is key. And if you have any gaps, you do experience hair loss. And in the beginning, we have 7 different sites. So the first several patients, we're kind of figuring out how to get the best fit. And then skull shape varies between different countries. I know that sounds odd, but it does. And so we were having a lot of loss of hair on the crown. So we learned how to increase pressure from externally to make sure that the cap fit better.
Good morning. Bob Carlson, Clinical Oncology News. Could you briefly describe this device, what it looks like, and what's the regimen? How often is it used and
Yeah.
when?
So I would encourage you to look for yourself. Both the companies that have scalp cooling devices are here, but it's a small unit about this high, and it's a refrigeration unit, and it has a piping that connects to 2 caps, and those the way it works is it circulates a coolant. So this cap only needs to be fitted once, which is very different than the cold caps that have been available in the U.S. for a really long time. And for this study, we standardized the cooling times. So it was worn for 30 minutes before chemotherapy, the entire duration of chemotherapy, and that time can vary depending on the chemotherapy regimen, and then for 90 minutes after. So typically we will have a patient stay for 30 minutes after chemotherapy, so it does add 1 hour to a patient's time that they're at the clinic.
Charles Bankhead, MedPage Today. A couple of questions. One, is there any recommended care when between chemotherapy sessions that you advise patients to do any treatments, anything like that to their scalp? Yeah.
Yeah. So we recommended sulfate-free shampoos because they're a little bit gentler on the hair. And we also recommended using a lot of conditioner and combing hair while in the shower because it is true if you yank on the roots a lot that you can have more hair loss. And we discouraged coloring hair and using a lot of like straighteners or things that would tug at the roots.
The other thing is you had a 50-50 chance of hair preservation. Did you find any differences between the people who lost hair and those who didn't?
Yeah, so I think the biggest thing is type of chemotherapy. So there are several reasons for that, but this device works much better with taxane-based chemotherapies, and that's known from a lot of European trials. And it works remarkably well with a weekly paclitaxel regimen. I mean, we had incredible success rates in that group. So perhaps if a woman is really concerned about hair loss, that might factor into the decision of type of chemo that they decide to use.